Hello, everybody. All right. Welcome to Cosi Talks. All right. We got a good show tonight. Y'all sent me some really nice questions. Questions that I think are going to benefit a lot of people who are listening to the show this evening and in the replay. Speaking of replay, if you are listening to the replay, let me know by putting replay into the comments section. I do like to go back and see who was watching the replay and also catch any questions that you might be posting. Sorry, I'm trying to set up my microphone here so I don't smack it off the table like I've done in the past. Ha ha ha. All right, guys, as you jump on board, give me a shout out. Let me know who you are, where you're from, and what is in your drink. I am hitting the hard stuff tonight, guys. Oh, yeah, it's been one of those days. So we're going to start this evening off right. All right. Cheers. Hey there, Vikram. Thank you for joining in. You've been joining in the past few sessions. I really appreciate that. Thank you for coming. And we've got, let's see who else we got on board, guys. Don't be shy. Oh, also, I am streaming from my YouTube channel. I'm trying to kind of put that out there a little bit more because I know some folks aren't really crazy about watching live stream on Facebook, and it's a little bit easier to manage from YouTube sometime. Hey, speaking of YouTube, we got Bill Ames listening on board. We got Tom on board from Canada. We got Brian with his Bustelo in hand. Brian, today I can't handle the Bustelo this time of night. I'll be honest with you, but just a little something to keep me awake for the next hour or so while you guys ask me all these really wonderful questions. Let's see who else we got on board. We got to see some people popping on board here. So guys, I got a lot to talk about tonight. There's a lot of good stuff coming up. There's April, Limb Loss Awareness Month is coming up. And this is kind of the first year that I'll be actually like, I have something structured and planned for Limb Loss Awareness Month. So I actually have my act together this year, guys. Hey, Andrea, nothing in your Cosi cup, getting ready for bed. Thank you for joining us, Andrea. We've got Trent on board from Colorado with his coffee. We got Barbara. Thank you, Barbara, for those pretty emojis you always send me. Sound. Oh dear. Can y'all hear me? Whoops. 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 How about now? Hey, Phil, thank you for joining us. Can you guys hear me a little bit better now with that? Yeah. OT month in April. Holy cow, Andrea. Well, yeah, we got to show you off then. All right. Sound is good. All right, guys. Thank you. As usual, you know that when it comes to tech, ironically enough, I am no bueno. Hey, Bob, thank you for letting me know. All right, guys, so we've got a nice little group on board already, so we're going to go ahead and get started. My name is Cosi Belloso. For those of you joining me for the first time, welcome. I'm a physical therapist, amputee specialist here in Tampa, Florida. I've been doing this show now. I was just kind of thinking about it. I was like, holy smokes, I've been doing this show for a little over 3 years, broadcasting to this public page. And so many things are happening this year that I'm just so excited. I'm excited to see that the show is reaching more people, and I'm getting more emails every week from people watching the show and getting the information from it, which for me is just, that's the whole reason behind this show. The program that I created, the Cosi Talk Strong Body Fitness Program, is also expanding in really, really exciting ways. So in the next few weeks, we'll hopefully be able to share some really exciting news with you. And then coming up later on the show, guys, I am going to talk a little bit about Limb Loss Awareness Month. There's going to be a really nice giveaway that I'll be doing. So stick around, listen up, because I'm only releasing the giveaway information in this video. I'm not posting it anywhere else. So y'all know like those Easter eggs that the Marvel movies like to post in there, and only the people who know what they're looking for see the Easter eggs. So that's what I'm doing tonight. There's going to be an Easter egg giveaway that I'm putting into this show tonight. So only people who watch this show are going to be able to do this particular giveaway. There you go. Hey, compadre, what's going on from Miami Beach? All right, we got Sandra on board. Brett, there's Brett with Kansas. I was waiting for you, Brett. Is wine allowed, Patricia? Absolutely. Only the kind of wine that you can drink, not the kind that you speak. So yes, bring it. Bring it on. In fact, if I knew more about wine, I'd probably be having one right now instead of my Diet Coke. Oh, Andrea got her AK book. Wonderful. Comadre. There you are. Now I can start. It's a party. All right, guys. So I had a lot of you guys tag me this week in your support groups with questions. Thank you for doing that. I actually really like it when you guys tag me in the support groups when you see a question that you think I might be able to answer, or if you yourself have a question. don't be shy. Email me or tag me in the support group. Hey, Chuck, glad you could join us. And we got Teresa there. There's Teresa. All right. So first question. Actually, this one was emailed to me, and this particular individual emailed me and said, is it possible for you to discuss or have one on the show to discuss depression after amputation? Mine was due to a motorcycle accident where the other person was at fault. Now, for this individual, I believe this individual is listening now, you're not alone. I mean, let's just start out by saying it. You're not alone. Mental health is something that I've come to feel more comfortable talking about on the show more often. Not because I'm uncomfortable talking about mental health. It's more because I'm not a psychologist or a psychiatrist, right? So I'm always very careful about what information I share with you in terms of how to work with mental health. This is something that I learned very early on in my years as a young therapist. I worked in very intense situations. I was working in infectious disease situations where, I was working with end-stage AIDS patients in spinal cord injury, obviously working with patients who found out they were never going to walk again, working in burn trauma centers. So very high pressure cooker environments where psychology was something that I had to learn. I was very, very fortunate that in the hospital I worked at, Jackson Memorial in Miami, we had not one, we had two amazing trauma psychologists. My favorite one, his name was Mario. And, Mario and I were good buddies, and I would take him with me. I would bring him in with me during my patient treatment sessions because, as you guys, many of you know, when you're going through this incredible trauma, right, those first 2 to 3 days, like literally some of these poor folks had just been scraped off the road from some horrific accident. They're barely alive and they're being told by the PT, we got to get you up and moving. And folks are still just trying to process what happened to them, right? So usually what would end up happening is they would refuse. They would refuse treatment with therapists. They would refuse all treatment with nurses and things like that because that's the only thing that they could control. Okay. So I learned that I needed to be able to get my patients to do what they needed to do because insurance was going to boot them out and I had to get them ready for the next step. But I had to do it in a way that was going to allow them to feel control over what was going on in their own life, right? And give them tools that they could work with. So this is, again, where the role of the trauma psychologist for me was so important. They would come in with me during treatments. And between us, the three of us, myself, the patient, and the trauma psychologist, working on coping strategies, okay, to help the individual get through the treatment, whether it was coping strategies for pain, coping strategies for, just processing what had happened, right? And then Mario would pull me aside and he'd say, okay, for the next treatment, this is how you want to approach your patient. This is what you want to do, right? So mental health is something that, I can't tell you, it's just as important to me as the physical healing process. It truly is. And I've said this several times before, overall health, overall well-being, for me, it's emotional, spiritual, and physical, right? You got to have those three in balance, right? When one's not in balance, the other ones go wonky as well. Okay. So, when you've experienced a physical trauma, whether it's amputation, whether it's breast cancer, whether it's, I think part of the first step is acknowledging that this is a problem that's bigger than you are, right? My dear mentor, Paul, I would also observe with him a lot, and he would tell the patients, you are a normal human being, right? Reacting in a normal way to an abnormal situation. So I'm going to repeat that because I think that's a really important phrase for mental health. You are a normal human being reacting in a normal way to an abnormal situation. If y'all agree with that statement, give me a thumbs up in the comments. Give me a thumbs up. Okay? Because think about it, guys. It's not normal for our limbs to be removed from our bodies, right? It's not normal for our body to turn on itself and start growing cancer, right? Can we all agree on that one? So when we can acknowledge that, then we can also start to look and say, okay, what do I need to do with the situation? Okay. And in the same way, good, I'm getting some thumbs up here. Y'all had me nervous for a second there. In the same way that when you had your trauma, whether it's because you were in a motorcycle accident, whether it's because you had cancer and your leg was being removed, whether it's because you had infection that was not healing, you're not going to go and amputate your own limb, right? Master of the obvious, right? So if you're not going to be in charge of amputating your own limb and you need a surgeon, you need a clinical, medically trained professional to do this and to help you physically heal from this, why wouldn't you need someone to help you with the emotional and spiritual healing? And I know that might sound like master of the obvious, but even for me, guys, even for me when I was going through my own breast cancer treatments years ago, these are things that I had to process. And I'm a clinician. I've been spouting this stuff to my patients for years, right? So it made sense for me that I would go see my oncologist to monitor the progression of my cancer and to help me heal, right? It would make sense to me that I'd have the nurses right after my surgeries helping me with my drains and helping me with my wounds and healing. So why wouldn't I need help, outside help, for the psychological, emotional, spiritual side of that? Right? So guys, what happens? I'm like posting a lot of master of the obvious questions. What happens if you try to do your own amputation? Right? No bueno. No bueno. What happens if you try to handle your psychological healing, your emotional healing, your spiritual healing by yourself? Right? Just putting that out there. So that's the generalized information that I can give you with regards to mental health. If you don't find someone to help you, right? Oh boy, all these messages just love coming in right when I'm in the middle of the broadcast, right? So if you're trying to heal yourself because you don't need anybody to help you, okay, what's going to happen, right? Complications. The same way that if you try to do your own amputation, right, bad things would happen. Infection would be the least of it, right? Bad things would happen. So what happens if you try to heal your own self on your own with no outside help? Depression, post-traumatic stress disorders, all of these other mental health issues that are going to eventually come back and bite you in the rear. Okay. Now, the level of help, outside help you might need, for the psychological, the emotional, spiritual healing, that's going to vary from person to person. The same way that the amount of help that you need in healing physically from your surgery varies from person to person. Right? And guys, I don't mind sharing my own personal story. For me, okay, a lot of my, right, it actually came after I finished my treatment. Ironically enough, and this was not something I was expecting. I went through multiple surgeries, multiple rounds of chemo, and I was keeping it together, family, faith, wonderful. And it was after the treatment ended that things started really going woohoo, right? And it took me a while to realize that I needed to have someone to talk to, someone who could objectively look at me and say, yes, you're doing the right things, keep doing them, right? So that you can continue to heal, because it's going to take a lifelong process to heal from this. Or that person might have come to me and observed me and listened to me and said, no, we need to kick it up a notch and take it to the next level for treatment. Right? Okay. And guys, it's still, it's still something that's very difficult to talk about. Nobody wants to think of themselves as, because even in my own head, I was just like, am I losing my mind? Am I going crazy? These things that get into your brain, and you realize, okay, you know what? I need someone who's trained in this to help me discern what is going on. And this can come in many different shapes and flavors and sizes. I already named the trauma psychologist. There are so many people in our community that can help you in this road. You know, that we have support groups. And now the silver lining with COVID is we now have virtual support groups. So you actually have more options available to you if your local support group maybe isn't your cup of tea, right? And we have organizations, for example, Hanger has an amazing support group system. The Amputee Coalition has another amazing support group system, right? That all you have to do is just kind of Google and put your zip code in. That's one way of doing it. And then within the support group itself, either because the leader of the support group might be a trained mental health professional, or they can refer you to someone in your area that can help, right? Many of us are churchgoers, right? In my case, I'm a Roman Catholic, and there are several priests in our, diocese that have been trained in counseling. So for me, that was the route that I decided to take because it was very connected with my faith. And I also knew that these priests had the counseling and they had the knowledge to know, okay, does she need to go to a psychologist? Does she need to go to a psychiatrist? In my case, I did not. But again, it's people who can screen you from a third-party perspective and let you know this is what's going on with you. This is how you can cope with it. And this is the next step for you. Right, guys? Right? All right. So let's see. A lot of comments have come in. So I'm going to zip it for a minute and read some of these comments. Jill says, good. Oh, Johnny. Hey, what's up, Johnny? Watching from the National Disabled Veterans Winter Sports Clinic at Snowmass Mountain, Colorado. Very nice. All right. Teresa says, I feel like everyone has their cross to bear. Ours just happens to be limb loss. The book, When Bad Things Happen to Good People, was a good book. That was such a good help when I read it. Teresa, it's interesting. For me, the saying that would go in my head was, this is the hand I was dealt. I'm either going to play or fold. Those are my only two options. That's basically it, guys. When you're handed something like a cancer diagnosis or amputation that you're going to have a limb removed from your body, it's basically play or fold. That's it, right? So we all have our ways of processing and dealing with it, right? Marianne's on board. Thank you, Pastor David. We got Jill on board. Johnny says, loss has a grieving process that takes time and it's different for every individual. It is. It really is. And guys, I'm just like not even grazing the top tip of that iceberg. Again, I am not a mental health professional. I am not a psychologist. I'm not a psychiatrist. These are just things that I've learned over the 20 plus years that I've been working in healthcare, right? And then from my own personal experience with breast cancer. Jennifer says, counseling is a must, in my opinion. We all need help. In my case, faith is helpful as well. You can have counseling and faith at the same time. Abso-friggin-lutely, Jennifer. Absolutely. I mean, the statistic still stands. 95% of the world's population believes in a higher power. Whatever higher power you believe in, whatever religion you prescribe to, there is something there. And this is something, guys, that, as I recovered from my cancer diagnosis, I got a lot more brave about bringing this up with my patients. The whole, my filter would go out the window. And I would, especially when I worked home health, I would ask my patients, is there a church you like to, because many of my home health patients were homebound, meaning before COVID, they weren't leaving their homes. And you could see that they needed that support, that they needed that enrichment in their lives. And many of them would say, yeah, I used to go to church and I feel depressed not being able to go to that. So that would get worked into our physical therapy goals. Okay. Right? It's a great motivator, let me tell you. Ryan says, not only trained, but someone that you can trust. You can become very vulnerable. Absolutely. And guys, I will say this, and I say this because I was speaking to a friend the other day, and we were having this conversation. You need someone who is outside of your inner circle, right? In my case, I have an unbelievably supportive family. I have a wonderful husband, friends, parents. I had the most wonderful support in my community, and I know how lucky I am. But when it came to addressing my mental health recovery from cancer and putting my life back together, I knew I needed someone who was outside of my circle, someone who could objectively look at my case. Right? They were going to see a young mother with 4 young kids, right? It's kind of hard not to see that, right? but they needed to see the objective side to keep a clear head when they were making recommendations for me. And that's something that I really, really, really stress with folks, that no matter how supportive your family is and your friends, it's good just to have someone outside of that, right, to help give their professional opinion. Let's see. Wendy says that this is relevant for those who've experienced COVID or long COVID too, feeling a little crazy over here. Oh my gosh. Yeah. Like I said, even before COVID, when I worked with home health patients, that's what I did for 8 years before I opened up my practice here in Tampa. You know, you see the effects of people who are cut off from society. They're cut off from society. Their mobility is drastically impaired because of whatever it is that they're going through. Some of them, it's end of life. They know that they're reaching their end of life, right? So fireworks everywhere, right? David says, I know this drill well. It happens. Yeah. Hey, Karen, glad you can make it. You're going to be in time for your question. Tom says, the biggest thing that helped me was becoming a peer visitor, putting myself out there. And guys, let me just take an opportunity to name just a couple of the resources that are available to you in the United States. And I believe, Tom, correct me if I'm wrong, is this available in Canada? Just can you, you're based in Canada, so can you just confirm that for me, please? Amputee Coalition, guys, is usually the first place I send my amputees to, and saying, call them, find out where is the support group in your area, okay? And find a certified peer visitor. So the certified peer visitor is exactly that. Someone who has been certified and trained, who is an amputee themselves, right? To help with the process of processing being an amputee, right? And this can be for whether you are in the hospital just getting out of surgery, or even some amputees that are years out of their amputation, right? That they never received that foundation support in the beginning. And years later, they find that they need that support. And again, guys, the certified peer visitor is not necessarily going to be the mental health professional, right? But they can be someone who can connect you to that mental health professional or to whatever resources that you need in the area, right? And the same thing with the support groups. I know I hear some folks say, well, I'm not really a support group person. I don't like talking in public with other people and strangers. I get that. I get that. But again, for me, it's also a place that you can find resources, right? Find out who are the psychologists. Whoops, the daisies, I'm going to knock my microphone over again. Do that every night. Or, finding clinicians that you need, right? So Tom says, yes, there is in Canada, woohoo, certified peer visitor program, but there was nothing when I became an amputee. Hey, Stephen, Jack's in the Cosi cave. All right, I need a swig. All right, here we go. Okay, ooh, this was a fun question. I like this question. This one said, my friend has recently had an above-the-knee amputation. Her insurance is no longer covering her PT. I would like to help her with her own exercise routine, but she doesn't have a prosthetic. Do you think that your above-the-knee book would help her, or is it recommended for those with prosthetics? Thank you. I love those questions. Y'all know where I'm going with this one, right? All right. So guys, here's the book that they're talking about. There's an above-the-knee book. There is a below-the-knee book. Okay. These books, between the two of them, have 150 combined exercises that have been adapted for amputees. These exercises are for the arms, legs, core, balance, and flexibility, okay? And the way I designed this program, it takes you from beginner, meaning before you even had your prosthesis, through advanced and higher athlete activity levels, right? And everything in between. So it's designed to be a fitness program. It's a fitness program written by a physical therapist. Okay, so the best way to utilize this program is to take it to your physical therapist, right? Even if it's a physical therapist who's worked with amputees, especially if it's a physical therapist who's worked with amputees, this is a great book because these are the kind of books that we use in the clinic to prescribe the exercises to our patients, right? And it's a wonderful visual aid just to see how to adapt these exercises so that when you go home, you know what you got to do, right? And for those of you who are working with physical therapists who don't necessarily have a lot of amputee experience, again, this is a great book because any licensed therapist can open it, look at it, and then start adapting the exercises for your plan of care. Yeah? And of course, I knocked my paper down. Hang on. All right. Okay, so let's go ahead and do the Easter egg. So I told you all in the beginning of the show tonight that for Limb Loss Awareness Month, I finally have my act together, and I'm gonna do something kind of cool, or I think at least it's kind of cool, for Limb Loss Awareness Month in April. Okay, so what I'll be doing is every day in April, I am going to go live on my Facebook and YouTube. I'm only going to go live for a couple of minutes, and I'm going to give I call it Jeopardy factoid on amputee. Now, guys, what I'm doing in April is not necessarily for you guys. And I know it sounds like, what did you talk about? What I want is to help bring education and awareness to the community at large, right? I have a lot of, friends in my community, and they're always very curious. They're curious as to the work that I do with amputees, but also how amputees lead their lives. The basics. How do you put a leg on? What's a leg made of? All of these things that are that they wonder about, but they don't want to ask questions. So we're going to go ahead and answer those questions. So what I'm going to do is every day, we're going to start off with a factoid, and it's going to go live on Instagram, Facebook, YouTube, all my social platforms. Okay. And I have a wonderful group of supporting companies and organizations that they're going to be helping me share this information out. So here's where the giveaway comes into play. I will be giving away to one individual a full annual subscription to my Strong Body video program and a book. That's over $200 worth of prizes right there for one lucky individual. They're going to get the video subscription and their book in one package. And this is all you got to do. Share the post. That's all you got to do. Now, when you share the post, you got to be sure you tag me on it, because that's how I can track you. So share the post and tag me. I don't care if you're sharing my Instagram, my Facebook, my YouTube post, or the story, or whatever it is. If you share my post, you get a raffle entry. Every time you share, so there's 30 days, 30 opportunities for you to share. Every time you share, you get another raffle entry. Does that sound cool? And guys, like I said, I'm going to be putting stuff on Instagram, Facebook, YouTube. So you guys are going to have an opportunity to do it on all the different platforms, wherever you're most comfortable. But remember what I said, you have to tag me so that I can find your name and put it in the raffle basket. Does that sound cool? Can I get a thumbs up? Oh, come on, guys. It's a cool one. Give me a thumbs up here. Steven says Bob is laughing behind my back. Bob does all sorts of crazy stuff behind my back when he thinks I'm not looking. All right. So guys, the whole point with this is to help spread awareness, right? So just to help, use April, use the Limb Loss Awareness Month, wear the orange. There we go. There are my thumbs up. I was like, dude, guys, really? I thought this was a cool one. Okay. So again, lucky winner gets a full year subscription to the Strong Body program videos, 150 videos. And they also get a copy of the book. All right. So let's see. All right. Thank you guys for those thumbs up. All right. Stephen asks, what is my take or opinion on osseointegration? That's a very good question. So osseointegration, guys, it's a procedure that is done whereby, I don't have anything I can demonstrate here. So traditionally, obviously, to put on a leg, you have to put your residual limb into the socket, right? And then the rest of your leg is connected through there, right? So with osseointegration, the point is to get rid of the socket. And the way they do that is they take a metal rod and they insert it into, right now it's being done as an above the knee. Primarily, you see more above the knee osseointegration procedures done in the US, mainly. Okay. So they take the metal rod and they insert it into the femur, and a little piece of it will stick out of a stoma. So it sticks out of the skin, right? And that area is called a stoma. Then they put a special abutment, special little device on there, and the prosthesis connects directly to that abutment process. Okay, so the point being, you don't have to use a socket. So this, we did a huge series of shows on this, and this was actually back in 2019, towards the end of 2019. So those of you who want to go watch a more detailed version of the show, if I'm not mistaken, I think it was September, October 2019. I did a full month on osseointegration featuring the Oprah system. So there's a couple of different surgical techniques on osseointegration. The one that I featured on the show was the Oprah system being done by Integrum. That's the name of the company. Okay, so we gotta make sure we get all the names correct. All right, so it's a two-part surgery. The first surgery is to insert the rod. Then the person has to go through a healing process. And then the second part of the surgery is to create that stoma, create that opening, right? And then there's another healing process. So it's a pretty lengthy healing process from this surgery. A lot of the purpose of the surgery originally was for people who simply could not tolerate wearing a socket, right? People who had massive skin breakdown, that there was just no way that they could tolerate wearing a socket. Maybe they had a lot of skin grafts, on their residual limb. Or they had a very, very short residual limb, and it was very difficult to get good suspension in the socket, okay? So these are just some of the reasons as to why a person would consider, looking at osseointegration. And it's a procedure that for the past couple of years, it's starting to pop up a lot more in the United States now that the FDA is starting to allow it in. Don't even ask me all the different layers of approval for that, because I don't know that right now. And we're starting to see more of it. Okay. I am personally looking forward to seeing the long-term studies on bone density, how it affects bone density, because again, it's going through the middle of the bone, the middle of the femur. So it's helping stimulate bone formation. It is a very lengthy recovery process. So I'm not going to sugarcoat that for you. It's a very lengthy recovery process. It's a recovery process that requires a full team approach. And I cannot stress that enough either. You need a full rehab team along with your surgical team following you during this process. Okay. If this is something that you guys are just more curious about, again, I would encourage you, look up Integrum, that they do the Oprah system. There's also something called the Press Fit. I don't know as much about that, so I'll be very honest about that. But this is something that you can start searching for. Okay. Let's see. Let me get through some of these messages. So Quantum Prosthetic and Orthotic says, we just started taking our bilateral BK amputee to meet other amputees at the hospital, rehab, and ortho floors. It's such a positive impact on all of the patients and staff, and not just amputees. Yeah. I'll be honest, guys. The only time, for me, I see my patients one-on-one. Like that for me is non-negotiable. That's why I opened up my own practice, because that was going to be the only way I could work with amputees in the outpatient setting one-on-one if I was calling the shots. In other clinics, they want to, anyways. The only time I've broken that rule is when it's been for the psychological well-being of my patient. And there were a couple of instances in the past where I had a below-the-knee patient who was finishing his course of treatment with me. And I would pair him in the same treatment with my newer below-the-knee patient who was struggling. Okay, and especially with my younger ones. And obviously it would be a much longer treatment because I'm treating two people at the same time. But for me, it was more about just sitting back, keeping my mouth shut, which y'all know that's not easy for me to do, right? And letting them talk to each other and provide each other with that support. And it could be two completely different human beings from completely different backgrounds, ages, demographics, whatever you want to call it. But the fact that they were going through this trauma together, it put something on the table there, right? All right. And yeah, it's a world of one. And as a clinician, watching these interactions when they happen, I learn a lot from it myself. And I hear things from my patients that they may not necessarily tell me. And it gives me that much more insight to help them. So, all right, we got, hey, there's Wendy. Well, and again, Stephen, he's mentioning there's Facebook OI group. I don't know much about that. With any surgical procedure, right, you're going to have your risks. There's no bones about it, right? You're going to have your risks. So it's a matter of, if osseointegration is something that you are curious about, right, you need to educate yourself. The same way that I tell you, you need to be an informed consumer if you are looking for a new foot, right? If you're looking at something like an osseointegration procedure that's going to require multiple surgeries with a long recovery, you need to do your homework, right? And it starts by going to the right sources, okay? It starts with going to the surgeon who has trained properly for this particular procedure, right? And asking them those questions. So educating yourself on, what are the complications? What are the pros and the cons of having this surgery versus continuing with your current socket? Okay. And that's usually when I have people approach me individually, usually that's where I start, is asking them, what is it about your current situation that you feel osseointegration can improve upon? And I usually start that conversation that way and just kind of get those gears rolling and get the person thinking like, okay, what is it exactly that I'm looking for right now with this? Right? Okay. Hey, Nanny's drinking Coke tonight. I got my Diet Coke right here. Cheers to you, Nanny. Hey, Rhonda. All right, I think I'm caught up with the comments. Let me handle this next question. Ooh, I like this one. So this person says, I have a question for those of you who walk without a limp. How is your balance on that leg? And what do you think contributes to being able to walk without a limp? Did you have to work on it, or did you just start walking without a limp? And then, so this was, obviously this is like my favorite kind of question, right? So first of all, I'm going to point you guys to my YouTube channel, because last summer of 2021, I did my 3-day live event series where I did just 3 days of broadcasting, massive education lectures, patient exercise demonstration, special guests, right? It's on my YouTube channel under 3-day live event series. One of those days was dedicated to gait deviations, which is just a fancy word for walking with a limp. I don't like to use that term, but that's basically what it translates. That's what a gait deviation is when you're deviating from the normal gait pattern, right? And there's many, many, many reasons a person can develop a limp or a deviation when they're using a prosthetic device, okay? I will say this. The people who put on a leg and start walking without a limp, without any training, I think I've actually only ever met 5 people in my 20+ year career. Okay. And I'm going to put that out there because I know there's going to be a lot of people that are going to say, well, I never had therapy and I went walking with my prosthesis and I did, and it's like, yeah, but you may have been walking, but there will be certain gait deviations, right? And that's usually something the physical therapist needs to analyze and pick up on. And guys, when it comes to analyzing gait deviations, this is where my modern technology has really proven wonderful with slow motion technology, because sometimes these gait deviations can be very subtle, where the person themselves doesn't even realize that they're doing it, and we only catch it on slow-mo. And the reason why that's important is because over the course of time, continuing to walk with these gait deviations, continuing to walk with this limp, right, can cause chronic overuse problems down the line. And we want to prevent that as much as we possibly can, okay? Can we completely eradicate a limp? In some cases, no. Some cases, we're not going to be able to do that. But again, it's because we try to get it to be as good as we possibly can, right? Victor says, is it because they might have been more developed muscular-wise? Not necessarily. So Victor, the people that I typically see, like those 5 unicorns, right, that put on a leg and just walked, typically were below the knee patients, younger patients. So they were in a better, their health was just better because they were younger, right? And they lost their limb due to trauma. So you're kind of on the ball there, Victor, in saying that they had just better overall health, okay? And these were people that they just had, it wasn't necessarily because they were athletic. My athletes definitely, they recover that faster for sure. But it's not necessarily the people who were athletic. It was just, they were just in tune with how they walked. That's all I can say. And again, these are unicorns. These are not the norm. Okay. So guys, what are the common things that can contribute to a limp? right? A lot of people will say, well, it's because your balance is off. And that certainly is a huge, huge part of it. Yeah. The only way that I can equate it is if somebody were to put me in a pair of 6 feet stilts and tell me to start walking, right? I'd be all over the place. So that's kind of in my mind when I think about someone who's first learning how to use a prosthesis. What does it feel like for them? The balance is completely going to be off. The other part of it is muscle strength, right? It's a beautifully complex human body, right? And a beautifully complex gait cycle. That's another video in my live series. I do the breakdown of the gait cycle so that you can see just how much is involved in taking one little old step, right? So in having the strength issues, and it's not just strengthening the muscle, guys, it's about teaching the muscle how to work with the other muscles. We call that neuromuscular reeducation in physical therapy. Big fancy words for muscles that have to learn to work together again. So it's not just about doing 40 million leg lifts in one direction, right, to get your glutes strong. It's about telling your glutes how to work together with the hamstrings, how to work together with the hip flexor muscles on the front part of your hip, right? Bingo, Stephen, a maladjusted prosthetic device, right? That can certainly contribute to a limp in so many different ways. And I cover some of those ways in that YouTube video that I just quoted to you, okay? So as a clinician, guys, and again, this is the part where the clinician needs to come and make this diagnosis, make this assessment. This is not something that you can do on your own. I've had so many patients come in and they are just like, I don't understand. I hit the gym. I'm strong as a rock. And I test them. Their muscle strength is perfectly strong. And they're just like, but I don't understand why I'm still walking like this. Okay. So it could be balance. It could be muscle strength. It could be range of motion. Range of motion. Where's Bob? Come here, Bob. You've been sleeping too long. So guys, here's for example of just how subtle this can be. Here's our pelvis, right? Hip bones, right? So while we're walking, our hip bones do what's called transverse pelvic rotation. It's a big old stodgy word for just your pelvis moving like this, okay? So our pelvis does this movement while we're walking, only it's not that big. It only does this much, 10 degrees. That's not a lot, like you can barely see it. And if you put on a bunch of muscles and soft tissue and skin on top of that, you're really not going to notice these 10 degrees of transverse pelvic rotation. Can I tell you how many times my patients have not been able to let go of their cane because they're not doing that movement? Right? And that's just a tiny, tiny little deficit. And it's about retraining the body to be able to move those 10 degrees at the right moment to coordinate with the rest of what's going on. Okay. So, and if that's what happens with just 10 degrees, imagine if you're having tightness in your hip from the hip flexors, right? And you're missing movement in your hip joint because of that. You're not going to be able to extend all the way, right? Those of you who are my below the knee amputees, if you're having tightness in the back of that knee, how is that going to limit you, right? And then we can get into the whole proprioception side of things that y'all know that's like my favorite topic to talk about is proprioception, right? Right? How many of you have an impaired sense of your proprioception that has not been rehabilitated yet? So maybe you do have good range of motion. Maybe you do have pretty good strength, but because you haven't worked on the proprioceptive side of things, your body's not recognizing where it is in space, right? So it's a bunch of all of these little things that can contribute to a limp, right? And this is where going to the therapist, guys, it's not just about doing random exercises. It's about determining what is the root cause of these problems, what is the root cause of these gait deviations, and addressing those particular roots. Otherwise, you're just throwing spaghetti at the wall, right? And yes, going back to the maladjusted prosthetic device, as that's kind of probably the favorite joke between the PTs and the prosthetists is the PT is going to say, well, everything I'm doing is right. It's something from the prosthesis. And the prosthetist is going to say, well, that's a great leg I made. It's because the PT is not doing their job. No, I'm kidding. But, basically one of those things that we do as clinicians is assess where is it coming from? Is the deficit coming from the patient's body in the form of weakness or range of motion or whatever? Or is there a deficit in the alignment of the prosthetic device? Or Both. Usually it's both. Right? It's both, because the person will be fit for the prosthetic device according to their body that day. And that day, the person is having weakness. And then as the person starts to get a little stronger, right, that old alignment doesn't fit them anymore. So they have to keep constantly adjusting, right? It is complex, but you know what, Pastor David, this is one of the reasons why I love what I do. I've been doing, like I said, I've been in healthcare. I've been a PT for 19 years. I've been in healthcare for well over 20, and I'm still learning, and it's still a challenge for me, and it still fascinates me. Right? It's like, this is where my nerd flag really goes high, guys, that when I see a gait pattern, and there are times where I go, I have no idea what the heck I'm looking at, and just trying to puzzle out what's coming from where, and how can we fix it, and how can we tinker and get it right. And then when you hit the nail on the head and you get the right thing, and you just do a song and dance and go, all right, we did it. So it's fun. Yeah. Okay. So Karen, yes. So Karen says, I have a lot of lower back problems. I walk well with a cane, but as I said in the post, I have a bad limp. So the follow-up question to that was, is it possible that the limp and the soreness on that side of my lower back after a lot of exercising is due to it being weak? Okay. So again, some insane number, like 80% of amputees develop or cite having some sort of low back pain within 5 years after their amputation. But let's face it, guys, 80% of the world's population experiences low back pain, right? Again, lots of ways and lots of reasons that can happen. All of the same reasons that I mentioned: weakness, tightness, laxity, right? The opposite of tightness, when things are too loose and the structures are not being supported, right? So in particular with your lower back, things that you look at are the core muscles, the deep abdominal muscles, the back muscles, your diaphragm, and the pelvic floor muscles. So if those things are not strong and working together, right, that's the center of the chain of command, right? Things after that are going to kind of fall apart. Okay, so if you find that you are doing these exercises, and after doing the exercises, you're having low back pain, that either means you're exercising too intensely, or you're not doing the right exercises and you're injuring and you're putting stress on weak structures. Yeah. Okay. I realized even today, guys, I'm doing a I'm doing a race on Saturday, and I'm trying to kind of pick up on my own training. I love to run. So I'm trying to pick up on my own training and get back into races now that races are happening again, right? But to do races, I have to do strength training. Like, I'm not 15 years old anymore. Shh, keep that a secret. So in order to do these races and not get injured and actually, maybe pull a decent time, I have to get stronger. And working on my core is a big, big part of that. And just this morning, I was doing a very aggressive core exercise, and I started getting pain in my lower back, right? And that to me was my red flag of saying, I'm not ready for this exercise yet. I got to take it down a level, okay, and build that strength up a little bit more before I do that higher level core exercise, right? Low back pain is telling you something's not right. Something's not right. And Karen, working with your PT and communicating this with your PT, okay, super important, because that way your physical therapist can adjust your treatment accordingly, right? The days of no pain, no gain doesn't happen anymore. Tom says it all came naturally to me. Prosthetist was always trying to trip me up at the beginning by junky feet on my prosthetic. Never made a difference. I was so lucky to have things work out the way they did. Yeah. Quantum says also the incorrect K-level components provided. Yes, absolutely. If a person is not in the correct prosthetic devices, woo, yeah. And for me, it all starts with the socket. If the socket is not fitting, regardless of K-level, right? Because sockets are not dependent upon K-level necessarily. If that socket is not fitting well, it doesn't matter how strong you are, how limber you are, how balanced you are, how zen you are. I don't care what you are. If your socket doesn't fit well, you're not going anywhere. Right? Marianne says, Michael is working on my right hip extension. Left is great, but my right sucks, and that is my strong side. Yeah. And again, guys, this is, I know it sounds like a little bit like, geez, is there any kind of silver lining here with this? physical therapy to me, the older I get, the older my body gets, and the more I realize how things are breaking down, the more maintenance we have to do. So whether you have one anatomical limb, two limbs, or no limbs, right? Strengthening, stretching, balance exercises, these are things that need to be a part of our daily lives, the same way that the healthy diet, right? That whole phrase of healthy diet and exercise, that's where this is included. It's not just for rehabilitation purposes. That's my PSA. What do you think, right? Brett says, new socket tomorrow. All right. Denise says, figuring out my gait issues and what I might need to work on is at the top of my list. And guys, it's a lifelong, in some ways it's a lifelong pursuit. I have some of you that you are constantly working on your gait pattern. You're constantly working. And I think that's wonderful. It means you're always trying to improve upon what it is that you have, and not in a negative way. I see so many of you that you're good about that. You're not saying, oh, I can't walk well. You're saying, no, I can walk well, but I know I can also always improve. Okay. Same thing with running or a sport. We might be able to run well, but there's always room for improvement, and we just keep working towards that. Right. All right. Let me see. Ooh, here's a good one. This one says, the hubby has gotten prosthetic leg. He had a lot of issues after amputation, so it was 8 months before he got it. Whew. Spent a lot of time in bed, lost a lot of muscle and strength. He's in therapy doing well, but he's discouraged because he's not progressing as quickly as he'd like. He's 64, right above the leg, above the knee amputee. He doesn't think he will be able to get in and out of our car or truck with the prosthetic. If anybody could share a video on how to do this. Okay. So this is one of those things where I jumped on this particular question because I'm just like, no. This is a rehab thing. So how many of you, let's do a quick little Cosi poll. How many of you worked on car transfers when you were in rehab with your therapist? How many of you worked on car transfers? I'm going to give you a second to put that into the comment section. Right? Brian says yes. Rhonda says no. Brett says yes. Steven says none. The other Steven says yes. Marianne says yes. So guys, this is one of those ADLs. ADL stands for Activities of Daily Living, right? And as physical therapists and occupational therapists, I'm sorry, Andrea, I really need to start showing you more love on this show because, PTs and OTs were like peanut butter and jelly. When it comes to ADLs, this is the end goal for us. So everything that we do about muscle strengthening and range of motion and balance, it's all to give you the tools that you need to complete your ADLs, right? So what are some of the ADLs? Being able to perform hygiene, being able to brush your teeth, being able to get dressed, being able to walk to the bathroom or get to the bathroom, maybe not walk, but get to the bathroom, being able to transfer out of a bed, being able to transfer into a car, being able to get up off the floor. I count that as an ADL. Okay. And we have a system by which we grade a person on how they perform the activity. There's actually a very objective grading system. It's called the FIM scale, right? And that's how we grade a person. Now, it could be that some people, right? There were some people that they just hopped right out of bed and they could get themselves into that chair easily, safely, and they managed to figure it out. Great. We would check that one off the list and we'd move on to a more advanced ADL. Okay. And there are some of you that maybe getting into and out of a car or your truck was not a problem, but this is something that we dealt with a lot, especially in spinal cord injury. Whew, let me tell you, teaching a quadriplegic how to transfer into and out of a car, whew, that would always get my heart rate going when I was a young therapist. Okay. There are strategies and techniques, and in some cases, there are assistive devices. Sliding board is a big one for someone who's really having difficulty getting from their wheelchair into the car. It's just a big wooden plank that you sit on one side and scoot yourself over to get to the other surface. Okay. So this is something that it's supposed to be addressed. Okay. Now, granted, guys, there are some people, especially when they come to me in outpatient, that they're already performing many of these ADLs, right? So, and I'll screen my patients. I'll say, are you able to get into and out of the shower? If so, do you use a transfer tub bench? Do you use a walker? How do you perform the activity? Okay. Do you have any difficulty getting into and out of the car? These are things that if I suspect, then I'm going to ask and I'm going to address it. Guys, don't be shy. Okay. Don't be shy. If you're having difficulty with any kind of movement in your home, in your life, bring it up to the physical therapist and occupational therapist, right? We're not going to know until you tell us. And it's happened to me on occasion, where I had a patient come into my clinic with a family member, and I just took it for granted that they were getting into and out of the car easily. And I learned that when I have a new patient, I follow them back out to the car after our treatment is over, and I just kind of eyeball to see how they're getting into and out of their car. And just see, because there might be, maybe they're doing it just fine, or it could be that the caregiver is like heavy duty lifting, or there's something that can be modified to make it easier for them to do that. So, yes, this is something the physical therapist and the occupational therapist should be addressing. And if they're not, ask them to. Capiche? All right. Theo's getting a new test socket next week. Oh, yeah. Patricia was in rehab for 10 weeks, never worked on transfers with me. And again, guys, I'm trying to think for me, the most difficult transfers to teach were the quadriplegic transfers, right? Those were, I had some really, had some really close moments with those. And the rehab center that I was training at, it was Baylor in Dallas, Texas. They actually had, I'm not kidding, they had half of a car. I don't know how they did that. They sawed a car in half. It was like a car from the 70s. And so we basically had the front part of the car, the passenger in the driver's seat, to practice transfers. And it was right in the middle of the rehab gym. I remember my first day of my internship, I walked in and I'm just like, y'all don't mess around, do you? Right. And, it was something that we needed to practice with our patients. There were very, very few times where there was a patient that it was not appropriate to practice a car transfer. Very, very, very few. Very few. Certainly not with an amputee. That's something that needs to be addressed at the very least, right? Hilaire says, my hubby can do the car by himself, but he can't do it with the leg on. And again, that's something that, ask the PT. Ask the PT to help you. The patients that I know of that they are getting into and out of a car, they learn how to do it both with the prosthesis and without the prosthesis, right? Let's see. She says he taught himself to use the board and shower home. And the PT had no clue how to do. I'm sorry. Okay. Let's see. Marianne says, I have a handle that fits in my car latch. Works great to stand up from the car. Amazon is my best friend. Yeah. And guys, the same way you adapt your car, for those of you who adapt it for hand controls and things like that to be able to drive yourselves, how you get into and out of a car can also be adapted as well. Steven says, grab your leg with your hand and put it in the car. I'm a left AK, and that's how I get in and out of my Chevy truck, and that's kind of high. And again, it all depends on, what's the strength of the other leg. If you're having problems with your sound leg and being able to depend upon it, then, getting into and maneuvering can be just a little bit difficult, and also with the socket. So, again, some people, they get in and out of their car from the get-go like skinny grease lightning without a problem. And other people, they're just sitting there going, how do I do this? And they're struggling because they have some issues with their mobility. Talk to your physical therapist. The physical therapist is supposed to be able to do this. Any PT. It does not have to be an amputee PT. Okay. Karen says, my prosthetist had to put a connector on my leg that allows me to turn the prosthesis on in a way to get in and out of the car. Yeah, there's the adapter with the above the knee amputees that allows you to kind of flip the knee back and forth just to make it a little bit easier. But most people I know, they just kind of fold the knee up under them and move the leg into the car. So lots of different ways to do it. Practice. That's basically what it boils down to. All right, guys. I am going to give you a reminder. Okay, so guys, remember what I said, this giveaway is only going to be for the people who are listening to this show. So whether you're listening to me live right now or you're listening to the replay later on, this is only a giveaway for you guys, right? So thank you. This is my thank you for listening giveaway. In the month of April, I will be going live every day, God help me, for 1 or 2 minutes. And I'm just going to talk about things related to limb loss, living with limb loss, right? It's Limb Loss Awareness Month in April. It's the Wear Your Orange month. Okay. So I'm going to go live, Instagram, Facebook, YouTube. Anytime you share one of my posts, whether you share one of my Instagram stories, Facebook posts, whatever, tag me, share it and tag me, and I will enter you in a raffle. Okay. Each time you share, I will put your name in the raffle. So you'll get that many more raffle entries. This starts April 1st. Don't start tagging me just yet, guys. Unless you have a question, don't start tagging me just yet. This is for April 1st for when I go live. Okay. The prize will be a full year subscription to my Strong Body video program. And you get your choice of an above the knee book or below the knee book, depending on what you need. All right, guys. So keep watch out for those live videos that I'm going to be posting every day in April, and share away. All right, guys. With that being said, I'm going to go ahead and sign off. Ooh, next week, Click Medical is back in the house. All right. Click Medical are the makers of the, oh, look at my socket. Don't you like my socket cover? Joan made me a socket sock cover. Isn't it awesome? So Click Medical makes the fantastic RevoFit adjustable systems, right? So there's a lot of different ways that they can adjust the socket. We did a fantastic show with them about a month ago. So next Wednesday, Eric Neufeld, he is the prosthetist and founder of Agile Orthopedics in Colorado, and his patient Cameron Kennedy. They use this adjustable device a lot, right? And for me, guys, it's not just about bringing the education on the technical side of this device. I want you guys to be able to ask people who use it all of your questions. So that's what we're doing next week. Next week, Cameron and his prosthetist, Eric, are coming on the show. Cameron's going to tell his story, which, oh boy, it's a good one. And then they're going to answer your questions about the RevoFit adjustable system. Okay. I'll be sending out an email for the giveaways on that show. So check your emails if you haven't already signed up. So next week, guys, put it on your calendar, set your alarm on your phone, come see me, and we're going to talk with Click Medical. All right, guys, as always, thank you for letting me be a part of your lives this evening. I wish you well, and I'll see you next week, same bad time.